also have Laverne Gordon, a two-time survivor of domestic violence. Hospital advocacy is accompaniment and referral services by compassionate, confidential advocates to survivors or victims. Are there concerns or hesitations that you experience when deciding whether or not to seek medical care?
Almost 5 a.m. walking into an emergency room, the very thing that was crippling was shame. The idea of disclosing what had happened to me to the ER nurses was debilitating. And it took everything within me to come up with a lie about why I was there, even when I fessed up. And granted, I asked the ER doctor to stay silent. I really wanted to go home and be done with this whole ordeal, not understanding that it was the most dangerous time for me. It was leaving, and it certainly proved to be true. I went about, or left that ER thinking that I had done myself a service and I had also done my abuser a service.
We know that survivors make very personal choices about whether and who they may feel comfortable opening up to, as Laverne was talking about. A healthcare provider might be the person that they feel comfortable with. Might not be, but might be.
Like you mentioned, there's so many implications when you do disclose that if you do try to leave your situation, that is when you're the most vulnerable, that we don't have access and can't promise everything. And so just trying to reach out to our community organizations or partners or social workers, kind of everybody that's an ally, and trying to provide more comprehensive care.
Healthcare providers actually feel more comfortable asking their patients about their safety, responding to disclosures of violence when they've gotten some training, when they have some support, and knowing where they would refer someone for help.
Empowerment for me is what advocacy looks like in an ER or a hospital room.